Hi, I'm Dr. Craig Castanet. I'm going to go over some activities of daily living with you and show you how some tips so that if you have back pain, you do a better job at avoiding exacerbating your back pain on a daily basis. So I'll review some of the common things you might do during the course of the day and the better way to do them. First of all, let me talk to you about getting up and down from the bed or getting in and out of a chair. Well, let's pretend this is a car. What you want to do anytime you do anything physical in the way of a transition from one posture to another, you should hold your breath. And that's with any activity that challenges your back, that represents the demand, the physical demand on your back. The reason you want to hold your breath is that by holding your breath, you contract the trunk muscles, the abdominal muscles, the so-called core muscles. When you do that, you compress the air in your abdominal pelvic cavity, and that stabilizes the spine. I've used this over the course of number of years myself because I got some weight training background. In fact, I hurt my back, and so I've had to deal with back issues myself for 27 years, and this is a really important little tip. Let's say, for example, that I'm going to lay down on the bed, and we'll just pretend for a moment this is the bed. I'm going to move this out of the way, and if this was my bed and I was going to get into it, I would have a seat here, and then I'm going to hold my breath now as I transition down to the bed and roll over. So like this. And you notice when I did that I keep my spine in line in each plane. In this case, now I'm in a comfortable position on my back, and I'm straight with respect to my spine on my back. Most people will find it comfortable if they're on their back to put one or more pillows under the knees. That's not necessary, but if you're in acute pain, that's probably a really good idea. If you're not in acute pain, it's not necessary. You can just lie down in bed as you might otherwise. Some of this also depends on your particular anatomy. If you're a person with larger buttocks and you've got a gap here that's unsupported, then it might be a good idea to do this even if you're not in any acute back pain, to bend your hips and knees, because that kind of flattens your low back against the bed and provides more support. As far as beds and mattresses go, it should be a bed and mattress that is fairly firm so that it does support you and it doesn't sag in any position. But even one that's good from the standpoint of not sagging and being firm enough may not fit the contours of your body ideally. So for example, if you have the gap, as I spoke of earlier, then you may want to have your hips and knees bent so you can put pillows underneath the knees like that. If you prefer to sleep on your side, and that's probably advisable, in fact it's advisable for you to change your postures, whether you're seated or lying down, intermittently throughout the day or night, so that you don't impose the same load on the same tissues, because every posture and activity imposes certain physical demands on different parts of your back or neck. So it's advisable to sleep on your sides and your back. Sleeping on your stomach is probably inadvisable for anybody, just because doing so requires that you rotate your neck so far around. In any case, I'm going to transition out of the side posture, and if I was doing that in bed, let's say at night, I would hold my breath as I roll over, and then I'm going to, whoop, I lost that pillow. Then I'm going to put a pillow probably between the legs. That levels out my pelvis a little bit better so that my spine is not twisted in this plane. Now, in terms of the neck, I should have one or two pillows here so that my neck likewise is in a straight plane here and is in what we term a neutral position. You wouldn't want to sleep with too few or no pillows so that your neck is laterally flexed or bent that way, or with too many pillows so that your neck is like that all night. You want to maintain a neutral posture in every posture in which you sleep, whether it's on your side or on your back. Now I'm going to transition back to my back for a moment, and again I'm going to hold my breath as I do that, and I'm going to rotate my legs with my trunk so that I'm not twisting like this, for example. So I'm going to hold my breath, come over, and then I'd be like that, and then maybe I want to turn over the other way. So again, I'm going to hold my breath. I put a pillow or two here See, this is too low. So on my side, I'm probably better off with 2 pillows here for my neck. And probably ideally, you want to put a pillow between the legs also, like that. Now if I'm going to come back after a while, I'm going to hold my breath, come over, and in this position, to tell you the truth, for a lot of people, sleeping without a pillow is not a bad idea. Now you might want to use a little roll or something underneath the neck to encourage the curve that is physiologic and good for the neck. But for many people, particularly if you're not really thick front to back, sleeping on your back without a pillow is a better posture, because even one pillow for some people, especially people that are very slight, puts their neck in more flexion or bends their neck more than the neutral posture. This is probably closer to a neutral posture. If I have one pillow, actually that feels pretty good, and I think I'm still in a fairly neutral posture. But some people sleep with 2 or more pillows and their neck is jacked up like this. And if you have your neck bent like this each night for hours, year after year, it's not a good idea for your neck. You're constantly stretching certain tissues of the neck and tractioning them in a way that's potentially aggravating. Now I'm going to show you how I would transition to an upright posture. I'm going to hold my breath as I come to the side. And I'm going to hold my breath as I come up. And you notice I brought the legs down at the same time my trunk came up, so I try to maintain my spine in a straight position. And then as I come up, I'm probably going to hold my breath again. Now I can breathe normally. And again, that little tip, just holding your breath anytime you do anything during the course of the day, or your activities, your postures, is a really invaluable tip for people with low back pain. Little things throughout the course of the day can perpetuate your back pain, and those applying some simple tips makes a big difference. Let me give you another application as regards holding your breath that I think you can relate to. It turns out that holding your breath is essential to increasing this intra-abdominal pressure and stabilizing your spine. And if you ever watch weightlifters, you can hear them do exactly that. When they go to make a lift, when they're lifting a weight, they'll grab a bar, for example, and when they're going to lift, they're going to hold their breath. They'll do this, and you'll hear them. They'll go, oh. So they're holding their breath when they get it up here, and then they'll breathe in this position again, and then they'll hold their breath again to get it overhead. And then they'll exhale when they get it up, and then they'll breathe again when they get it up here. But this transition from here to here, when they're doing the actual lifting, displacing the weight up or down, that's always accompanied by holding their breath, because they know instinctively that if they don't do that, they can't handle the loads. And while the loads of normal activities are not the same, nonetheless, it's a very critically important tip for people with back pain. It's a real good safety measure. In terms of chairs, let me talk briefly about chairs. A chair like this is essentially 90 degrees. If I sit in this chair, I'm going to hold my breath getting into it. This puts my back in a little bit of bend or a little bit of flexion. I'm going to come up. This is what we term a neutral posture for the low back. It's straight, and I'm straight, and I have a normal curve here, which lumbar spines do, your low back does. As soon as I bend in my low back, either from above down like that, or from below up like that, I flex my low back. I take it out of the neutral position. That's more physically, biomechanically demanding on the back. So if you have a back problem, it's likely to exacerbate your symptoms. And you want to minimize those little contributors during the course of a day and during the course of your lifetime that tend to aggravate your back. When it comes to chairs, the more upright I am at a 90-degree angle, the harder it is on my back vis-a-vis opening up the angle and sitting in a reclined position. Now I can't recline this chair, so I'm kind of stuck with this. But to make the point, consider conversely if this chair was to have less than a 90-degree angle like that, and I was forced to sit like that. most of you probably can imagine that that would be provocative of back pain if I had sat like this for hours on end. Some people unwittingly do it when they're engrossed in their work at a desk and they're leaning over the work. Very bad idea. What you want to do is, if you've got to reach your work, try to get a chair, in any case, that leans back, open up the angle as much as you feasibly can from a practical standpoint, and still do your work. So what you want to do is get a chair that reclines, and bring your chair up to your desk as close as possible, and bring your work as close to the edge of your desk as possible, so that as much as possible you're working more over the course of your lifetime in a position where you're more reclined and closer to a neutral low back posture, with support. However, I'm sitting in a kind of a reclined position right now, as if this chair reclined, but it doesn't. But I wouldn't encourage you to sit reclined like this without any support here. You've got to have support. This is not a good way to sit. So when it comes to work, sit in a chair that can open up the angle. Sit like that. Move up to your desk and bring your work closer to the edge of your desk so that you can work closer to a position like that than the standard one where you're at a 90-degree angle like this. If you do have to sit, and sitting is provocative of pain, get out of the chair as frequently as you can, hopefully every 20 or 30 minutes or so. Stand up in a neutral posture, walk around a little bit, and many people find it helpful also to do the reverse and to actually try to arch your back a little bit like that. That undoes some of the stress on your back from the flexion or bending of the back associated with sitting like that. So all these little things make a difference during the course of the day. Sitting is inherently tough on the back, and you've got to try to mitigate that as much as possible by getting out of the chair, doing some back bends when possible, and being aware that finding yourself a chair that provides good support and opens up that angle is a really valuable thing you can do for your back. What else can I talk to you about? Getting in and out of the car. Let's assume for the moment that this is a front car seat, driver's side. I open up the door here. Ordinarily, of course, this armrest wouldn't be here. The ideal way to get in it would be to sit down here, and then as I hold my breath, come in like that. Again, anytime you're going to do something that's potentially demanding on the back, getting up and down, getting in and out, anything like that, hold your breath as you do it. Don't talk. Hold your breath briefly as you make that transition. Let's see what else I can find in here. Let's say I'm going to lift something like this stool here. I'm going to come over here. I'm going to get as close to this so I keep the load as close to my center of gravity as possible. I'm going to bend with my hips and knees also, not just my back. You don't want to bend like that. We've all heard that. It takes a great deal of stress off your back if you just bend your hips and knees a little bit. But what you don't hear is you need to hold your breath at the same time. That's really important. So as I come up with it, I'm holding my breath. Now as I walk with it, it's not as hard as the actual lift. So carrying is not as hard as lifting. Nonetheless, if it's very heavy, I'm going to probably hold it for some of the time that I'm carrying it also. So I might hold my breath there, stop, breathe a little bit. Again, and when I put it down, hold my breath again. Like that. When I just did that, when I get down and do that, there's a little bit of acceleration of the chair. That imposes certain modest demands on my back, but I was holding my breath too, because that movement here against that resistance affects your back a little bit, and anytime you do something that affects your back, just get in the habit of holding your breath while you do it. Makes a big difference. There's a lot you can do when you do that. Okay, that concludes this activities of daily living part. I'm going to do another part in just a moment.